Welcome to my channel. During puberty, a woman experiences the fullness of her life through the onset of menstruation. Menstruation is a natural process for every girl. During the menstrual cycle, various hormone changes take place in their bodies. As a result, mood swing and physical discomfort such as nausea, vomiting, and abdominal pain may occur during menstruation. Although not all girls experience these symptoms in the same way, a significant number of them do suffer from abdominal pain during their periods. But on this topic, they cannot always openly discuss or share with anyone, not even their family or friends. Additionally, there is a common belief that experiencing abdominal pain during menstruation can lead to difficulties in conceiving a baby. Hearing these superstitions around them, they become mentally depressed. So, in today's video, I will discuss what are the causes of abdominal pain during menstruation. Number 2. How to reduce abdominal pain during menstruation. Number 3. Is abdominal pain during menstruation something that can lead to difficulties in conceiving a baby? So, let's get started. Before that, we need to understand why there is bleeding during menstruation. Among the organs of the female reproductive system is the uterus. The uterus is made up of 3 layers, and the inner layer of the uterus is called the endometrium. During the menstrual cycle, due to various hormonal changes, the endometrium undergoes necrosis or breakdown, which we commonly refer to as menstruation. It is from this breakdown or necrosis of the endometrium that abdominal pain occurs during menstruation. I hope you will understand that. Now, let's get into our main discussion. Why abdominal pain occurs during menstruation? If you understand these topics properly, the better you will be able to grasp the nature of your menstrual pain. In medical terms, the abdominal pain during menstruation is referred to as dysmenorrhea. Abdominal pain during menstruation, it is generally classified into 2 types: primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea. If abdominal pain during menstruation occurs without any underlying medical condition, it is commonly referred to as primary dysmenorrhea. It is more common especially in unmarried women. Now the question is, how do we understand primary dysmenorrhea? In most cases, primary dysmenorrhea does not have a specific cause. However, some symptoms can help identify it, such as it often occurs more genetically, and if you hear a family history, a mother, sister, or someone in the family had abdominal pain during menstruation. Number 2. Age. During 13 to 14 years of age, menstruation brings. Primary dysmenorrhea usually brings at the start when girls start menstruating. It is more common in unmarried girls aged 13 to 18. The pain can start a day before menstruation and at least for the 1 to 3 days during the menstrual cycle. Number 3. Anxiety and tension. Most of the time, primary dysmenorrhea is associated with anxiety and tension, especially before the exams. Girl may experience increased pain. If someone is dealing with depression or stress, the abdominal pain during menstruation can be comparatively higher. Number 4. Due to endometrial necrosis, mild to moderate abdominal pain during menstruation can be experienced by most individuals. However, if you feel that the pain is more intense than usual and interferes with your normal activities, it may be considered primary dysmenorrhea. 5. Nature of pain. In primary dysmenorrhea, the pain often starts before the onset of bleeding and decreases as bleeding increases. The pain typically brings in the lower abdomen and may radiate towards the thigh and lower back. Number 6. Nausea and vomiting. Some individuals may experience nausea or a feeling of vomiting during menstruation. This is another symptom associated with primary dysmenorrhea. Number 7. Hormonal imbalance. Hormonal imbalance, especially involving estrogen and progesterone can contribute to primary dysmenorrhea. Observing this factor during menstruation can help in better understanding the managing the discomfort. Now discuss the secondary dysmenorrhea. Secondary dysmenorrhea occurs when abdominal pain during menstruation is due to an underlying medical condition. It is more common in married women, especially those aged 30 years or older. Additionally, if someone has never experienced abdominal pain during menstruation before but suddenly starts experiencing it, it may be indicate secondary dysmenorrhea. Conditions that can lead to secondary dysmenorrhea include secondary dysmenorrhea occurs due to underlying medical conditions such as endometriosis, tumors in the uterus and presence of any polyps or uterus, or the existence of infection like pelvic inflammatory disease. Additionally, discomfort during menstruation may occur if there is a chocolate cyst. Women using intrauterine contraceptive device such as copper T or birth control may also experience secondary dysmenorrhea. To differentiate between primary and secondary dysmenorrhea, an ultrasound can be performed for the definitive diagnosis. Now let's discuss how to reduce abdominal pain during menstruation. Primary dysmenorrhea. Primary dysmenorrhea is not caused any specific illness. It usually improves on its own after marriage or after giving birth. In most cases, the primary dysmenorrhea becomes significantly better after marriage or following a normal delivery. Therefore, there is usually no need to worry about it. However, following some guidelines can help reduce abdominal pain during menstruation in many cases. Number 1. Encourage mental well-being and provide accurate knowledge about menstruation. There is no reason to fear abdominal pain during menstruation. In many instances, the pain tends to decrease within 1 to 3 days. Number 2. Hot compression. If the pain is unbearable, applying a hot water bag to the lower abdomen or using water heater bags available in the market, it can be helpful. Purchasing these bags allow you to apply hot compression during menstruation, reducing the pain. Additionally, taking a bath with warm water can bring relief. Number 3. Light abdominal massage. You can also try gently massage the abdomen, which may be help to reduce the pain. Even after following this measure, if the pain persists, you can consider using over-the-counter pain relievers such as paracetamol 500 mg, taking every 6 hourly. If the pain still does not subside, you may up to medicine mefenamic acid available on the market as HPR or HPRDS. Taking this medication at 8 to 12 hours interval can often reduce the pain, inshallah. Once the pain is reduced, you can discontinue the medication. It is advisable to keep the necessary medication for pain relief before the onset of menstruation each time. Maintaining a balanced diet. Ensure regular intake nutritional food, regular exercise. Engage in regular physical activity, especially the butterfly exercise. You can find demonstration of this exercise on YouTube by searching. Incorporate it into your routine for its potential benefits, inshallah. If the pain persists despite trying the aforementioned measures, it is essential to consult with a doctor. A doctor may prescribe hormonal contraceptive to help to reduce pain during menstruation. In some cases, hormonal birth control pill can be effective. However, it is crucial to consult with a doctor before taking any hormonal pill. Hormonal birth control pill for pain relief during menstruation should only be taken under a guidance of a doctor. If you experience sudden pain during menstruation, especially if you have never had such pain before, it is important to seek advice from gynecologist. This is because the secondary dysmenorrhea is primarily caused by an underlying medical condition. Therefore, a thorough examination and diagnosis by a doctor are necessary to identify the cause and receive appropriate treatment. Taking medication without proper consultation can lead to temporary relief but may not address the underlying problem. Seeking medical advice is crucial to determine the cause and receiving appropriate treatment. Let's discuss the question that we commonly receive. Will there be any difficulties in conceiving if there is abdominal pain during menstruation? Answer is no. Generally, abdominal pain during menstruation does not pose any difficulties in conceiving. In fact, in many cases, the pain improves after marriage or a normal delivery. However, if abdominal pain during menstruation is due to a medical condition, it may cause complication during conception. In such case, consulting a doctor can help in addressing the issue, and with appropriate treatment, conceiving should be possible, inshallah. Can pain relievers can be taken during menstruation if there is abdominal pain? Answer is yes, definitely. Taking pain relievers for abdominal pain during menstruation is permissible and generally does not cause any problem. Using pain reliever to reduce pain does not pose a problem for future conception. Number 3. Is it okay to use hot water for pain relief during menstruation? Answer is yes. You can use warm water for pain relief during menstruation and it should not cause any problem. Hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to the channel for get health advice, health awareness and reproductive health related all the videos, and remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.